Well, this looks like a very nice examination room. I guess so assume that's where we are.
We are indeed. We have 6 exam rooms, and 4 rooms are with tables with stirrups, so we can do pelvic exams and women's health exams, and of course prenatal care as we intend, and also they double as regular exam rooms. And then we have 2 peds rooms that are specific for pediatrics.
And you have a gentleman here. Are you going to do a little exam for us today?
I do. This is Ken, and he's complaining of a cough. He's a heavy smoker. I've seen him for this before, and actually now that we have some ancillary services available, I was going to tell him about those as well. Okay. Actually, you're prone to a lot of pneumonias, Kenny. You've had those a few times too. And we have a hypnotherapist on site now that's how I quit smoking. He comes once a month, and we also can set you up with the health department to do the smoking cessation program and use patches. And another thing that we can do is prescribe Wellbutrin, which is a drug, it's similar to Zyban, which you hear about on TV, but it is covered for Medi-Cal patients as well. And it's like an anxiolytic, it's called. It keeps you from being anxious while you're quitting. So you can choose any of those treatment modalities, or you can quit cold turkey, or you can just keep getting sick over and over again. That's your choice. We try to give everyone choices, and ultimately I think the difference between our clinic and some others is that I feel like the patients have the responsibility to make themselves well. I can show them what all the choices are, and it's up to them if they want to. PA stands for partners in healthcare, and so.
Well, don't you get frustrated at times because you deal with a lot of people that probably don't cooperate with your plans?
Sometimes I do, but they're not really my plans. What I try to do is have them set up their own plans. So if it's an obese patient, I'll have her bring in or him bring in a diet log, and we'll sit down together and go over it. And then she can say, boy, I haven't eaten fruit in a lot of days, have I? Gee, I really do drink a lot of Pepsi. It brings them to a place where they can see things themselves, and it affects a change a lot more easily, I think, than if I'm there kind of waving my finger and trying to tell people what to do.
Now here we are on North Beale Road, getting close to Yuba College out here. I didn't know that you have laboratory facilities, so what do you do when you want to get a culture of his lungs or throat?
I have BioCipher lab right here. We do a strep test on everyone complaining of strep and send it out for culture. If the person has a positive strep test here, if we do a rapid strep, we go ahead and treat. If it's negative, unless there's another problem like a bronchitis or an otitis, an ear infection, we'll send the culture out, because many times it's a viral problem, and I don't like to overtreat. I don't like to just routinely give antibiotics.
And then, but what I really want to focus on is the fact that you have the laboratory services here.
We do. We have BioCipher lab right here.
Well, maybe you could show us that. Well, I noticed this impressive-looking sign, BioCipher Laboratories. I thought you were one of the high-tech corporations here doing genetic research, but I guess not quite. What goes on here?
This is our lab. We have a phlebotomist. So far, she's here only from 8 until noon, but as services expand, we expect to have her full-time. We do all our own blood draws here, pediatrics as well as adult. And for everyone on whom I do a physical, we usually get a complete workup, a chem panel, a complete blood count. We have a high incidence of hepatitis C in this area. We do HIV testing.
Do you actually run the tests here, or do they send them to a central laboratory?
They send them to a central laboratory. They pick up once and sometimes twice a day if we have things that need to be
sort of call it a drawing station and a collection point.
Exactly, a drawing station and a collection point.
Very good. So now we're talking to Chris Taylor, office manager here, our administrator. You do everything, many hats here at Harmony Health. I'd like to ask you, though, a few questions about who can come here as a patient. Do you have any specific rules or restrictions regarding insurance plans and things like that?
No, we would try to accommodate everyone. All insurances are welcome. We are free to call on a moment's notice, and we don't turn anyone away. We do try to accommodate everyone. If there's insurance problems pending, we offer them a payment agreement which really works out really well for the patient and for us too.
So Medi-Cal is not a problem, Medicare is not a problem?
No, we welcome everyone, new Medi-Cal patients and Medicare also.
Very good. What hours are you actually opened? I didn't ask that.
I'm sorry, yes. We are open. The office hours are 8:30 to 5, and we are closed from lunch between 12 and 2. And we also do have Saturday hours, which is a really nice plus. A lot of people would like to be accommodated. They're working during the week, and they can come in on Saturday also.
Like Saturday morning or all day?
Right now it's Saturday morning, usually 9 to 1. We're really flexible with that. If we have people that need to come in a little bit later, we can also accommodate that.
So someone that has a cold, flu, backache, sprain their ankle, you name it, they can come in. They want to have their gynecological evaluations and those things. No problem.
No problem, that's right.
That could be done even then on Saturday, too.
Yes, it can.
The phone number here, in case people want to make an appointment or ask about your services?
Our phone number here is area code 530-743-6888.
That's 743-6888. And they could make an appointment, ask questions, learn about what's going on when you're opened and all of that with that phone call. Right?
Yes, that's true. And we also do have interpreters available. We have Spanish speaking and also Hmong.
Oh, that's fantastic.
Yes.
And so should they tell you on the phone if they're going to be coming for that with those languages, or are they here pretty much all the time?
We do have translators available at all times. Mm-hmm.
Great, fantastic. You do a lot of work with children's health and different disability programs. Can you tell us about that?
Yes, we have a state-funded program called CHDP, and this serves infants up to teenagers. It depends on age-appropriate exams. Sports physicals are welcome too. Along with that, they get the regular screenings for a physical, and it also includes immunizations. It's a very good program. Very few people know about that, and I think that it's something that a lot of people could take advantage of.
Well, I'm really impressed with your facilities and the services and everything. The physical plant here, it's quite a place you've got here.
Thank you so much.
What other programs do you want us to learn about before we finish up today?
We have the Healthy Families program. I wanted to mention that real quickly because CHDP is basically for patients who are healthy, and for those low-income patients who are ill, this will cover them at a very low cost, and they can join. It's like an insurance for low-income people, and we can set them up right here for that as well.
So whether someone has one of these programs or not, the abbreviations and letters I can't remember, or they have regular insurance, private insurance, I'm sure you'd be willing to see those patients too. Medicare, Medi-Cal, share of cost. Cash, of course, never hurts any business, of course. You're welcome to have them. They come, right?
Everyone is welcome here. We really try to be a haven for everyone, for all types of services and all types of people, all types of incomes.
Well, on the Medical Explorer program, we like to introduce our community to the variety of services, and it's been a pleasure being here today. Thank you very much.
Thank you so much for coming.
Again, I'd like to thank the staff of Harmony Health for allowing the Medical Explorer to check out their nice facilities. If you have questions about the primary health care services offered at their Linda location, feel free to give them a call. Well, that's our program for tonight. I'd like to invite you to write to me at my dermatology, cosmetic laser surgery, and liposuction office in Yuba City with your suggestions for areas and people that you'd like to see on our program. I'm always interested in hearing from you, and I hope that you'll suggest to your medical doctor or other healthcare professional that you'd like to see them here with me on the Medical Explorer. As you know, the Medical Explorer is a public service program, and we really do want to hear from you with your comments and